Preventing skin side effects in children taking targeted therapies. If you are involved in the care of a child on targeted therapies, such as a BRAF or MEK inhibitor, you may be aware that these medications can have side effects related to the skin. Side effects are very common. In fact, sometimes up to 100% of patients on targeted therapies have changes in the skin. These side effects include skin dryness, worsening or new appearance of rash, as well as redness and swelling around the nails. There can also be increased skin sensitivity to the sun, which can increase the risk for skin cancer long term. Prevention is key and can help avoid and/or manage these side effects. In this video, we will review the prevention strategies that are recommended for all patients on targeted therapies. These are gentle skin care, nail care, and sun protection. Gentle skin care. Does your child have dry skin? Dry skin can be very bothersome, as it can be itchy or painful. Fortunately, dry skin can be better managed by incorporating gentle skincare into your child's routine. To make it simpler for you, here are the top 3 tips you should know. Tip 1. Take a short bath or shower daily. The bath or shower should only last 5 to 10 minutes, and the water should be lukewarm, not hot. Your doctor may also suggest your child take dilute bleach baths every other day as part of their overall skincare routine. Here is how to prepare a dilute bleach bath. Add a 1/4 cup of household bleach, like Clorox, to a half-full standard tub of warm water. Alternatively, if you are using a smaller bathtub, then you can add 1 teaspoon of household bleach for every 1 gallon of water. Tip 2. Use a gentle, unscented cleanser. You can use a creamy, unscented bar soap or a liquid cleanser. Tip 3. Moisturize immediately after bathing. Following a bath or shower, gently pat the skin dry and avoid rubbing dry with the towel. Apply a moisturizer to the whole body. But how do you know which moisturizer to use? The moisturizer should be unscented and thick, preferably a cream or ointment. Lotions and oils do not work as well. Lotions are too watery, which means they evaporate quickly. Oils don't work as well because they are too runny. You can talk to your healthcare provider for more suggestions. Ultimately, the best moisturizer to use is the one your child likes and allows you to put on. You may need to moisturize more than once a day. Here's a good rule of thumb. If your skin feels dry, it's time to moisturize. Gentle skincare also involves avoiding things that can be harsh on the skin. As previously mentioned, it is best to avoid long, very hot showers or baths, fragrances, and harsh soaps. In addition, avoid using bubble baths, bath bombs, exfoliants, and vigorous rubbing of the skin. You may have considered using natural products for your child, but natural products are not necessarily safe. They can irritate and cause skin allergy. Avoid using vegetable oils, tea tree oil, lavender, and essential oils. Now, let's review our top 3 tips for gentle skincare. They include 1. Taking a short bath or shower daily. 2. Using a gentle unscented cleanser. And 3. Moisturizing immediately after bathing. It may take a little bit of work at first, but sticking to these tips will make a big difference for your child's skin. Nail care. Have you noticed redness, swelling, or cracks in the skin around your child's nails? Do they suffer from ingrown toenails? These are painful and uncomfortable nail problems, but they can be prevented with proper nail care. To make it simpler for you, here are the top 3 tips you should know. Tip 1. Trim the nails straight across. Avoid trimming the nails too short or rounding the edges. Tip 2. Wear shoes that fit well. Shoes with wide toe areas are best. Avoid shoes that are too tight and those that put pressure over the nails. Tip 3. Avoid picking at the nails. To care for skin around the nails, use a gentle cleanser and a thick moisturizer, preferably a cream or ointment. Now, let's review our top 3 tips for nail care. They include 1. Trimming the nails straight across. 2. Wearing shoes that fit well. And 3. Avoiding picking at the nails. Following these tips will keep the nails healthy and happy. Sun protection. As most people know, sunburns can increase the risk of skin cancer. Therefore, sun protection and preventing sunburns is very important. To make it simpler for you, here are the top 3 tips you should know. Tip 1. Avoid the sun. You can do this by seeking shade, especially around the peak hours of 10 a.m. to 2 p.m. Tip 2. Wear sun protective clothing. When going out in the sun, cover as much skin as possible by wearing long sleeves and pants. Remember to also wear wide rim hats and sunglasses. Some types of clothes are better than others. Tightly woven cloth, such as denim, canvas, or synthetic fibers, filter out the sun and are better than cloth that is sheer and thinly woven. Keep in mind that if clothing gets wet or stretched, it becomes more transparent and less effective at blocking the sun. Additionally, UPF clothing, which stands for ultraviolet protection factor, is very effective at protecting your skin from the sun. Tip 3. Wear sunscreen. You can make wearing sunscreen a part of your morning routine year-round. When choosing a sunscreen, choose a broad-spectrum UVA and UVB sunscreen with SPF 30 or higher. SPF, which stands for Sun Protection Factor, is a number that tells you how long it will take for the sun's UVB rays to redden your skin if you apply sunscreen, compared to the amount of time without sunscreen. If you use SPF 30, for example, it'll take you 30 times longer to burn than with no sunscreen. Apply sunscreen liberally to all exposed areas. Reapply every 2 hours as needed or immediately after swimming or excessive sweating. Some worry about the safety of sunscreen. The ingredients in mineral sunscreens, zinc oxide and titanium oxide, are generally recognized as safe and effective. Chemical sunscreens contain chemicals that can be absorbed into the skin, but currently there is not enough evidence to know if it is harmful. If your child is over 2 years old, it should be safe to use chemical sunscreens. Now, let's review our top 3 tips for sun protection. They include number 1, avoiding the sun, number 2, wearing sun protective clothing, and number 3, wearing sunscreen. These simple tips will help prevent painful sunburns and promote healthier skin long term. You have reached the end of this module on preventing skin side effects. By now, we hope that you have a better understanding of gentle skincare, nail care, and sun protection, and feel more prepared to care for your child's skin.